mean for, a quick checkup or fixing a tiny chip, I want you to imagine you need a full smile makeover.
A big one.
Mm-hmm.
We're talking every single tooth needs to be restored.
Mm-hmm.
Your bite, the look of it, everything.
Exactly. And that's usually a massive life-disrupting undertaking.
Oh, absolutely.
You're looking at weeks wearing these uncomfortable temporary teeth that feel like plastic Halloween props.
Right. Or you're looking at a bill that looks like a down payment on a car for a full set of ceramic veneers.
Or the other option, you sit in that chair for 6, maybe 8 hours while a dentist, hand sculpts resin onto your teeth layer by layer.
Hoping they have the artistic skill of Michelangelo and the steady hand of a bomb disposal expert.
And hoping you can keep your mouth open and, crucially, dry for that entire time, which is a marathon.
I don't care who you are,
Yeah.
sitting with your mouth open for 4 hours is absolute torture.
It's exhausting just thinking about it, but what if there was another way? What if you could, I don't know, essentially stamp a perfect new smile directly onto your teeth?
Using digital precision.
Right. With high-precision digital tech, 3D printing, and here's the real kicker, letting the dentist keep the whole area surgically dry the entire time.
It sounds a little like science fiction, maybe wishful thinking, but it's actually the focus of the paper we're looking at today.
It is. We are doing a deep dive on a fascinating technical paper called Full Mouth Rehabilitation through the Resin Stamp Technique.
This comes to us from Dr. Pedro Hideki Hiramoto, Dr. Camilo Sampaio, and their colleagues. It's a collaboration between institutions in Brazil and NYU, published in the Journal of Prosthetic Dentistry.
And our mission for this deep dive is to really unpack how 3D printing, digital scanning, and some pretty old-school dental tools are merging to make this kind of complex work faster, cheaper, and maybe even longer lasting.
And longer lasting is the key phrase there, because in dentistry, longevity almost always comes down to one thing.
The bond.
The bond.
Okay, so let's start with the why. Why do we even need the stamp technique? Why can't dentists just, freehand this stuff like they used to? I mean, there are some real artists out there.
There are, and many still do. It's called the freehand technique. But just think about the difficulty level. You're building a tooth shape, layer by painful layer, with a material that's sticky and hard to work with.
And you're doing it inside a dark, wet cave, which is the mouth.
Precisely. The patient's breathing, their tongue is moving. It is so technique sensitive. If the dentist is having a slightly off day, or their hand shakes even a millimeter, the result suffers.
So the industry moved towards something else.
Exactly, towards injectable composite resin.
Yeah.
The idea is you design the perfect tooth on a computer, you print a clear mold of that design, inject a flowable resin into it, and place it over the tooth.
So it's like a custom mold for your smile. It takes the artistic variable out of the equation.
Right, it's more predictable.
That sounds great. Cost-effective, predictable. So what's the villain in the story? Why isn't everyone doing this?
The villain is moisture, saliva, humidity, even the moisture in your breath.
Ah.
For resin to bond properly to your enamel, the tooth needs to be bone dry, hydrophobic. If moisture gets on that surface for even a second, the bond can fail.
And then the restoration pops off, or you get decay underneath it.
Exactly, which is where that dreaded dental dam comes in, that rubber sheet they clamped onto your teeth.
Right, the thing that isolates the teeth.
It's the gold standard.
Yeah.
It turns a wet biological environment into a dry work table.
Yeah.
But here's the conflict. Historically, digital scanners and dental dams do not get along.
Why not? I mean, a scanner just takes a picture of what's there, right?
Well, it's about optics and geometry. The scanner light can reflect off the shiny rubber or the metal clamps that hold the dam in place. It creates noise in the scan.
The computer gets confused.
It gets confused. But the bigger problem is physical. If you scan a patient's bare teeth and design a guide that fits them perfectly,
And then you go to the real world and put a big metal clamp on one of those teeth.
the guide won't fit. The clamp is a physical obstacle that wasn't in the digital plan.
It's like designing a tight-fitting glove and then trying to put it on over a chunky ring.
Perfect analogy. It just won't go on. So dentists usually have to choose. Do I use the digital guide or do I use the dam for isolation?
And this paper says you don't have to choose. The innovation is forcing the digital world to adapt to the physical constraints.
That's the core breakthrough. They digitize the obstacles.
Okay, let's get into the how, because this is where the tech gets really cool. The workflow starts pretty normally, right? Photos, scans.
Yeah, standard start. Facial photos, a scan. They use something called a Lucia jig.
Oh, sweet jig. That sounds like a dance move from the 50s.
It does, doesn't it? It's a small acrylic device that sits on your front teeth, and its job is to deprogram your jaw muscles
Deprogram, like erase muscle memory.
Exactly. Most of us have a habitual bite. We close where it's convenient. The jig separates your back teeth, lets the muscles relax, and lets the jaw settle into its most stable, natural position.
So you find the true home for the jaw before you build the new house. Makes sense.
Correct. So they have the photos, they have the jaw position. Now comes the part that, honestly, it made me do a double take when I read it.
Oh.
Step 2 in the paper, they put the dental dam and the metal clamps in the patient's mouth.
And then they scan it with all of that stuff in there.
And then they scan that. They use an intraoral scanner to capture the geometry of the teeth and the clamps.
Wow. So you're capturing the whole surgical field, not just the teeth.
You are. You're scanning the entire environment of the procedure.
Why is capturing the clamp so important?
It's so the software knows where the no-go zones are. The 3D printed guide needs to know, hey, don't put any plastic here. There's a big metal clamp in the way.
I see. So you design around the obstacles, like mapping out boulders before you build a road.
Precisely. They bring that data into CAD software, like Exocad, design the new smile, but when they design the guide, the stamp, they tell the software to create clearance around those clamp areas.
I saw another specific detail in there. They set a 1 millimeter internal offset. What does that mean?
That is a crucial technical detail. It means the inside of the guide is designed to be slightly larger than the teeth. There's a 1 millimeter empty space.
Why leave a gap? Don't you want a really tight fit for precision?
You do, but you need a carrier for the resin. That 1 millimeter gap is reserved for a clear silicone that we'll talk about. If the hard printed resin touched the teeth directly, it would be too rigid. You need a soft buffer layer.
Okay, so we have a digital design that avoids the clamps and has this 1 millimeter gap. Now we go to the printers.
We do. They use a high-resolution resin printer, and they print 3 key things. First, a model of the patient's mouth with intercalated teeth.
Intercalated, so alternating. Every other tooth.
Yes, like just the central incisors and canines, but it's keeping the teeth in between. Then they print a second model with the full set of new teeth, and finally they print the guide itself out of a clear, biocompatible resin.
Why did the alternating teeth model first? Why not just do them all at once?
Stability. If you try to stamp every tooth at once, the guide is just floating. It can rock or shift. By doing every other tooth first, you use the untreated teeth as stops or anchors.
Ah, I see. You keep some of the original landmarks to orient yourself. That's smart.
And once those first teeth are done, they become the new anchors for the second round.
Okay, let's talk about the secret sauce of this stamp. The paper mentioned relining.
Right. This fixes a major problem with older methods. In the past, you'd print the guide and inject resin directly into it. The problem is, the printed resin and the restorative resin are chemically very similar.
They stick together.
You stick together aggressively, they chemically bond, so you cure the tooth, you go to pull the guide off, and you rip your beautiful new restoration right off with it.
Ouch. That completely defeats the purpose. You need a non-stick coating.
You do. So to fix this, they reline the printed guide. They take that printed shell, apply an adhesive inside, and then squirt in a clear silicone material. They press this onto the printed model of the new teeth.
And that silicone fills the 1 millimeter gap we talked about.
Exactly. And crucially, composite resin does not stick to silicone. So when you're done, the guide just peels away cleanly.
It's like greasing a cake pan, but with high-tech optical-grade silicone.
A very accurate, transparent cake pan. Because remember, the curing light has to pass through all of this.
So now we have our guides. The patient is in the chair, and this is where the digital plan meets reality. The dentist has to use the exact same clamps they scanned weeks ago.
Yes, this is high stakes. If they use a slightly different clamp or put it in a different spot, the guide won't fit. The whole digital plan relies on that specific geometry.
Okay, so they clamp up, put on the dam, the environment is dry, they prepare the teeth.
Correct. But here's the material innovation that I find most compelling. Usually these injectable techniques use what's called flowable resin. It's like a thick liquid, but it has a downside.
It's weaker.
Generally, yes. It has a lower filler content. Think of concrete. You need rocks, the filler, and cement, the resin. Flowable has fewer rocks, so it's more prone to chipping and wear over time.
But you can't inject a thick paste. It's like trying to inject cold peanut butter through a needle.
It won't flow. Exactly. So this team came up with a sandwich technique inside the stamp.
A resin sandwich. Okay, walk us through the layers.
Layer 1. They take a strong, packable composite, and they push it into the guide by hand. This creates the main body of the tooth. It gives it strength.
So the core is strong, but if it's stiff, won't it leave gaps or bubbles?
That's the risk.
Ah.
So layer 2. They add a thin coating of flowable composite over the packable resin, right on the surface that's going to touch the tooth.
What's the job of that flowable layer?
It's a wetting agent. It ensures the stiff packable resin adapts perfectly into all the nooks and crannies of the tooth without any air bubbles. It eliminates the voids.
So you get the strength of the paste and the precision adaptation of the liquid.
That's it. And because everything is clear, they press the sandwich onto the teeth and shine the curing light right through it all to harden it.
And they do this in stages, right? The intercalated teeth first.
Right. They stamp every other tooth, cure them, remove the guide. Now those new teeth become solid anchors. Then they switch to the second guide and fill in the gaps.
It feels incredibly systematic. No sculpting, no guessing. Just prep, stamp, cure, repeat.
It turns an artistic challenge into a procedural one. It takes so much variability out of it.
So let's look at the results. What does the patient walk away with?
They walk away with a full mouth rehabilitation. The aesthetics are fantastic because the shape was designed on a computer, and the strength is superior because they used a strong, packable resin.
And what about the bond strength?
This is the invisible win. Because the whole thing was done under a dental dam, the enamel never got wet. The bond strength is maximized. That means these restorations are going to stay on.
Okay, it sounds perfect. But in these deep dives, there's always a catch, right? What's the limitation here?
There is one, and it's a physical one. You cannot restore the specific tooth that the clamp is actually holding.
Ah, because the clamp is physically in the way.
Right. The clamp covers the gum line and part of the tooth to hold the rubber sheet down. The stamp guide can't reach that area.
So the teeth holding the clamps, usually the back molars, have to be done separately.
Yes. You either restore them freehand later or with a different technique. The paper is clear about that. The clamp interferes.
You can't paint the floor you're standing on.
That is a perfect analogy.
Yeah.
But for the other 20-something teeth, it seems like a game changer.
And it seems more efficient, too. Less waste.
It is. They use way less silicone, and clinically, it really reduces chair time compared to freehand layering.
Which brings me to the so what of all this. To me, it feels like this is democratizing high-end dentistry.
I think that's a very fair assessment. A full mouth of ceramic veneers can cost as much as a luxury car, and it involves grinding down healthy teeth. This is additive. You're adding to the tooth, and resin is much, much cheaper than ceramic.
So you get the perfect smile design that you get with expensive porcelain, but you're doing it with more affordable materials and in a way that removes the human error of freehanding it.
And, critically, without sacrificing the quality of the bond. Usually cheaper meant faster and riskier. This seems to be faster, cheaper, and chemically safer because of the isolation.
It's amazing, all from just rethinking the order of operations. Scan with the dam, it seems so obvious now.
It just challenges the assumption that the digital workflow needs a naked mouth.
We've covered a lot of ground here. We started with the problem of moisture and artistry. We walked through scanning metal clamps, designing with these tiny offsets, and printing a whole manufacturing kit.
And we ended with a resin sandwich that offers the best of both worlds, strength and adaptability.
It really is a fascinating intersection of pixels and polymers. It makes you wonder what else is just waiting for this kind of digital twin approach.
Well, that actually leads me to my final thought for you, for the listener.
Mm-hmm.
We are seeing a shift where the digital twin of a patient is becoming so accurate that we can now account for the tools we use during the surgery itself.
The tools become part of the scan.
Exactly.
Yeah.
We aren't just scanning biology anymore. We are scanning the intervention. If we can digitally navigate around a dental clamp today with this kind of precision, what physical barriers will digital dentistry remove next? Could we scan around surgical retractors in heart surgery? We are moving from static models to dynamic, procedure-aware digital twins.
That's a wild thought. The computer doesn't just know what you look like. It knows what the doctor is holding in their hand.
Exactly. It bridges that gap between the perfect virtual plan and the messy reality of clinical work.
Well, on that note, we're going to wrap up this deep dive. Whether you're a dentist, a tech enthusiast, or just someone hoping for a better experience in the chair, thanks for listening.
Keep questioning the workflow.
We'll see you on the next deep dive.